trenches. With me now is Nicole York, a telemetry nurse at Penn Medicine Princeton Medical Center in Plainsboro, New Jersey. Nicole, thank you for being with us.
Yeah, no problem. Thank you for
Can you
having me.
can you tell us a little bit what's going on out there and what it's like out there?
It's overwhelming. The most significant event that I could never imagine experiencing as a nurse in this profession. It's been pretty wild. It fortunately started as like a slow progression in the beginning of March, and it started as just a trickle of patients at first, because we didn't really have the right testing for the patients. The tests would take a long time to come back, so it was hard for us to tell exactly how many numbers of patients we had at first. But I was one of the first nurses to start taking care of the patients when they started coming in on our unit. None of us have ever experienced a pandemic or crisis like that before. It's something I've personally always been kind of interested in doing, disaster response, and that's part of the reason I wanted to do travel nursing. That had actually been in my plans I was going to be leaving the hospital around June to start doing travel nursing. But obviously that is all changed right now. But
everybody's plans have been changing lately.
Yeah.
The whole world's plans have been changing lately.
Exactly. Everything's kind of at a standstill right now, and I just got to count my blessings that my family's safe and I have a job right now, because a lot of people can't even say that the same right now. So
now, I guess there are a lot of tough days. Does one stand out to you as being more challenging?
Well, yeah, I would say so. And it kind of felt like every day every day was more challenging than the previous. Because at first, like I said, it was a slow trickle of patients, and maybe we'd have, 4 or 5, 6 COVIDs on our floor, and then there was a day I went home and I came back 2 or 3 days later, and there was like half the floor was COVIDs, had isolation carts outside the rooms, and I came in and I just, started having, my heart started racing, and I was completely overwhelmed because I didn't think it could happen that quickly. And then you look over in the ICU and you see the nurses, being pushed to their limits over there, taking care of these vented patients, because there's only so many nurses that are trained to take care of patients on, sedation, drips, and taking care of this level of acuity for patients. So you saw that surge too, and it's just overwhelming,
It puts you in situations, I guess, that obviously you had to tell loved ones that they couldn't visit their sick relative, and a sick relative would sometimes die alone, I guess, right?
Yeah, absolutely. That's been one of the big challenges too, because our hospital never had visitation policies in the general floors. I think in the critical care unit, it did have restricted hours, and maybe in the pediatric unit as well. But on our floor, 24 hours a day, family were welcome to come in. And it was a drastic change. And we get a lot of the same patients. We call them frequent flyers. People come back that have been there before, so they're used to the rules prior to this pandemic, and now they have to experience this completely new set of rules in order to try and prevent the spread of infection. But it's been really tragic, because we have patients that get really sick, and families don't get that closure of being there and with them and trying to help and support them through that end of life process. And people are dying younger than anyone should be dying, because a lot of the patients that are really sick are younger, or between 50 to 70 years old, which is a big loss for everyone. And it makes us all really scared too, because even though I might be in a lower risk population because I'm younger, I have a mom at home that I have to protect too, and I just have to pretend like even if I'm asymptomatic, I might be a carrier. I'm also on immunosuppressants, which might make it so that I'm more likely to be asymptomatic carrier, because my body wouldn't show the same responses. um, as other people who contract the virus. So I have to always pretend like I'm infectious and like I could potentially, spread that to my family or my boyfriend or,
You, your
very isolating.
your unit usually handles heart patients, right?
Hmm. Yeah.
So I guess when a lot of this was going on, a lot of the elective surgeries and your regular patients just had to reschedule, I suppose, right?
Oh yeah, that's caused so much frustration for a lot of our patients too, because we'll have to discharge patients that need a whole bunch of other tests to be done in order to, treat the normal reasons why someone would come to the hospital, and they can't be done right now. And it's like, okay, well, when will it be done? And we're like, after this, and that's what everyone wants to know, like, when is this going to end, when is this going to get better, and I'm starting to see the levels on my unit of like the levels of patients kind of come like trickle down, which is good. It means everyone's been following the social distancing protocol. We haven't been getting as many new patients. It also means that a lot of people have died, so we don't have as many patients on the floor anymore. But as soon as the businesses open back up and people go back into the world, maybe are less strict with their infection prevention, we might get a surge again with more patients. So
Now, the spike at your particular hospital happened around early April, and it kind of died down a little bit by mid-April. Is that correct?
it seems that way. It seems like around then we started getting less patients on my unit. The ICU though has still been like kind of full to the brim the entire time.
Mhm.
And it might just be that we've been, patients have died. That might be the reason that we have less, and less people are coming in because they're following good practices outside of the hospital, which is good. I mean, that's part of the job, that kind of absence of self is the best way to, putting the patient first, patient-centered care. It's kind of essential to our job in order to do what we need to do, and also to not um, allow ourselves to feel all of the gravity of the emotions of what's going on around us and how little control we have. And all we can do is as much as we can at any moment for the patients that are in our care. And so we just gotta, get up, go to work, and get the job done. And it's very emotionally challenging to be, unsure of when the end is going to be happening. Like, I've been a nurse for 2.5 years, and the there will be a lot of trauma when we're experiencing, losses of patients and stuff. But it's a loss, and then you can cope with it and move past it. But with this, it's harder because we don't know when it's all going to be over, and it's hard. But in the at least there's been so much support, and from the fire department, and it's funny that you mentioned that, from the fire department and police department. Just I think it was on the April, what day is it?
I
April
get
12th
confused too. I
or
get confused
something.
too with the days.
Yeah, I can't keep the days straight, but I think it was around like April 12th or 11th. The fire department and police department in all local communities came and surrounded the hospital and did a parade. Well, I was so happy I was working that weekend because all of us were crying. They paraded around the hospital with the fire trucks and police cars, and were honking their horns and raising up flags on the big ladders. I can't believe that a fireman can get up on those ladders. They are tall. They're like taller than our building. I can't imagine getting on one of those. So it was it was overwhelming to see these heroes, like, saluting us, it was cool. And lots of local businesses have shown their support too. We're so well fed. It's fantastic. They're giving us lots of food during the day, and for night shift too. And people are all trying to do their part. Wawa gives out free coffee. Although I feel like I can't go in there like with my scrubs on. I have to just bring my badge because I feel like there's like, I don't know, feel like a little isolated, alienated, because if I'm in scrubs, they're just kind of like a stay over there, you know, which is understandable because I look like infectious if I'm wearing scrubs.
Well, you know, out in the street, everybody's kind of like that way to everybody else, so that makes
Oh
it
yeah, absolutely.
better. And I think you told me that you haven't been able to hug your mom in a couple months, right?
Yeah, that's like it's starting to really bother me. But we talk from across the hall,
Mhm.
and I like you know rub my skin, wash it like crazy, and then I'll make us dinner, and then I'll like leave it outside the room for her to get and
Oh,
stuff.
oh,
And
oh,
we're trying.
that's something that mothers don't like, and Mother's Day is going to be coming up on us before you know
I
it. So
know, I know. All of us are struggling with that, but I'm just glad that this. I mean, I'm not glad it happened, but I'm glad it happened when it did. If it was gonna happen, because if it had been a couple months later, I might have already not even been in the state anymore, and I like need to be here with my family, with my coworkers who are my family at this point. You know.
we learn about the ins and outs of infection prevention.
Um, I've learned to be really, really cognizant of every surface I touch, and uh, you know I feel like we as a nurse you're already pretty aware of you know the bacteria all around you, the viruses all around you, but now more than ever I come on and whatever station I'm at I make sure you know you're wiping it down before you even go there, and you ever touch anything at all, it's like it never comes near your face at all. Like you touch any surface. I've been scrubbing my hands you go 10 minutes and you feel like you need to scrub your hands. It's um yeah, I think I've been a lot more aware now than I've ever been of infection prevention.
Have you have you had, is there a patient or two that stand out as far as how they met their end, and are those, what was that like? I mean, I guess, were you actually the person in the room because nobody else was in the room? You're the last person to say goodbye to them, that sort of thing?
Um, it's interesting you say it like that because with a lot of these patients, because we have to do this whole clustering of care to preserve our PPE, our the patient feels extremely isolated because they don't have family there, they don't have, and we have to limit our time in the room as well to you know reduce our viral load and preserve the gown usage. But I've had um, a couple patients that you know I've been the only one in the room and having to care for them, and it can be extremely backbreaking when you're you know the only one moving the patient, changing them, taking care of them and stuff. But when it comes to a patient declining to the point of being close to death, unless they are a hospice, oh yeah, if they end up choosing comfort measures, which is what hospice patients are. They choose to not do anything to preserve their life, and then you try and just make them comfortable and help them in through the dying process. I've had a patient that chose that while she was still oriented, and like while she still knew what was going on, she chose that, and I was the one that was with her while she was still, the dying process can take a long time, but I was with her while she was still alert. And I called up her family so that they could talk to her on the phone. Um, but that's all she got, was just to talk to them on the phone. So that was pretty overwhelming. But it was an honor to be able to be with her for that. So, you know.
Nicole York, thank you for visiting us here at Infection Control today.